Hello, my name is Madison Cleric, and today I will be presenting the horrors of the lobotomy. As a trigger warning, there is discussions of mental illness and surgical procedures. There is no graphic imagery or graphic vocabulary used, but it is a sensitive topic we will be touching on today. To start, a brief history of mental illness and mental health. In the 1900s, there was a lack of care and limited understanding. There was a very fluid definition of what it meant to be mentally ill. This could range from symptoms of anxiety to rebellious tendencies. Mental health was seen as something that would be damaging to one's reputation, and it wasn't quite understood, so it held a lot of stigma, and the stigma often had high significance in society. Ultimately, those who were mentally ill were placed under guardianship of either a family member or the state, who was in charge of allocating treatment, which often took place at asylums where the mentally ill were confined and placed in terrible conditions of overcrowding, neglect, and experimentation in order to gain understanding of the mental illness and the human psyche. Similar experimentation concept, trepanning. Trepanning is a good example of the human tendency to experiment when it comes to the treatment of mental illness. Trepanning is the oldest documented surgical procedure of all time. It is composed of the methodology in which the skull is drilled into and the manipulation of the exposed brain to try and lessen the severity of mental illness related symptoms. In the Bronze Age, this treatment was done for epilepsy, convulsions, and to release cerebral demons. In modern terminology, what would be known as mental illness symptoms such as anxiety or depressive tendencies. In the Middle Ages and Renaissance, it was also used to treat madness and epilepsy. It has been well documented throughout time through different art forms, such as this excerpt from a medical teaching journal, as well as this renowned painting by Bosch, The Extraction of the Stone of Madness, done in Madrid, Spain. This led to an overall evolution of what is known to be psychosurgery, and more specifically the lobotomy, which is similar to trepanning as it involves surgery and manipulation of the brain. The lobotomy is defined as a surgical procedure in which the nerve pathways in a lobe or lobes of the brain are severed from those in other areas, according to Encyclopedia Britannica. It is a form of psychosurgery. Psychosurgery is, once again, any surgical technique aimed to alter the human psyche, and it is used as a treatment of mental illness. The lobotomy aimed to treat schizophrenia, obsessive compulsive disorder, anxiety disorders, depressions, or anyone who had symptoms of delusions, agitations, violence, and self-destructive tendencies. Once again, that comes back to the fluidity of the definition of what it meant to be mentally ill. The lobotomy had a target anatomically of the frontal lobe, which was known to be a regulator of behavior and decision-making processes. It was theorized that the severance of the frontal lobe and the poor functionality to make correct behavior processes and decisions would lead to less severe cases of mental illness, or overall cause a decrease in the appearance of those mental illnesses, leading to the psychosurgical pioneer, Dr. Antonio Egas Muniz, who was known as the inventor of the lobotomy and is a 1949 Nobel Peace Prize recipient for his work with the lobotomy and other areas of psychiatry. Muniz was a Portuguese psychiatrist turned psychosurgeon, and once again, he was accredited with the creation of the lobotomy. Muniz theorized that the lobotomy was necessary, as mentally ill patients had the presence of abnormal neural connections originating from the frontal lobes. He based this on prior research done with chimpanzees and the removal of their frontal lobes and their cooperation increasing, as well as the effects of tumors in the frontal lobes and behavioral processes. He did this with a drill that was used to create an opening in the parietal region of the brain, in which he inserted a specialized tool known as the leucocomb, which was a wire connected to a sturdy rod that was retractable, in which he would insert the leucocomb into the exposed brain, creating pathways by moving it inward and outwards, up and down, in which he ultimately inserted ethyl alcohol to cause the destruction of the neural pathways. This was first done on the 12th of November in 1935 on a 63-year-old woman suffering from depression, anxiety, paranoia, hallucinations, and insomnia. The procedure was deemed as effective as the patient showed less symptoms prior to the lobotomy. In spirit, Dr. Walter Freeman took inspiration from Munez's work and was deemed as America's controversial psychosurgeon. He did redesign his approach, and he went in a process known as the transorbital lobotomy. So unlike Munez, he went through the eye socket. He used electroshock as anesthesia, so he would essentially shock his patients into a comatose state and then begin the procedure. The procedure in which he invented a specialized tool popularized by media as the ice pick and hammer, in which he would forcefully go through the eye socket into the cerebral portion of the brain or frontal portion of the brain and sever the connections with an upwards and downwards movement. Freeman did 3,500 lobotomies in under 10 minutes with the assistance of James Watts. Leading us to the perspective of the patient. This is important when it comes to studying the history of the lobotomy. One of the most famous patients Dr. Freeman had was Rosemary Kennedy, sister of U.S. President John F. Kennedy. Her parents ultimately allocated her to the procedure after she was diagnosed with agitated depression. Undergoing the lobotomy procedure, she was left with irreversible damage. As you can tell, she had a rebellious nature, and this ultimately led to her decision to get a lobotomy, or her parents' decision to force her to get a lobotomy, in which she was left in kind of a vegetative state. Leading to the downfall of the lobotomy. The lobotomy was crucial or criticized by many different scientific standings, starting with the physician's role. There was attempts to rebuke Munez's Nobel Peace Prize due to the horrific aftermath of lobotomy, leaving patients like Rosemary Kennedy in a zombie-like state. Freeman was discredited in the scientific community and seen as a monster with his disregard to proper medical procedures, as well as just lack of evidence for the procedure. The influence of media. Freeman used the media to advertise the lobotomy procedure. It was picked up in popularity, and that was how a lot of these guardians found out about the procedure. Some patients even reported undergoing the procedure just as a way to relieve symptoms voluntarily, but this false advertisement of the procedure as being a quick cure-all seemed to be problematic, as the results were misconstrued. So as I mentioned, it was portrayed as quick and efficient, where it was not. Oftentimes it left patients with irreversible damage in a zombie-like state. It was painful, and there was disregard for proper medical conduct. Patients were not informed of the procedure and did not give their consent. a lot of times in the mental institutions, it was the fact that they were there, and the lobotomy seemed to be the quickest and easiest way to rid them of the negative side effects of mental illness. But the lobotomy also opened a conversation on ethics, specifically medical ethics. So there was less authority given to doctors. In the instances where patients underwent lobotomies, the lobotomy was seen as a quick and efficient cure. The doctor was just able to allocate the patient to undergo a lobotomy without informing the family a lot of times, or doing more in-depth and looking into less invasive treatments before subjecting the patient to lobotomy. Of course, there were less invasive treatments, but there's also stricter guidelines, so doctors now have to look into make sure the guidelines of the disease fit the guidelines as to why the patient would need the procedure, as well as medical scrutiny, the overall effectiveness. So like I said, Freeman advertised the procedure as to be a quick cure-all for the disease, but it was not. It oftentimes left the patients in that zombie-like trance. So as a way to minimize the negative side effects and popularization of non-effective procedures, there was a conversation on this, as well as a conversation on informed patient consent, once again letting the patients know the dangers of the procedures, not just telling them that it is a quick, efficient cure-all. Finally, we saw a lessening of the lobotomy procedure as the introduction of psychoactive drugs in the 1960s. Psychosurgery is actually still in use today, but is still facing backlash of the lobotomy through the popularization of the lobotomy in media culture as being horrific and only showing the negative aspects, when in all reality the lobotomy began as a way to help others, but transformed into a monster as money and greed got in the way. Thank you for your time. These are my sources, the image sources.